Good day, everyone. Dr. Vanessa here. Welcome, Kingdom Health family. I'm not sure if some of you all saw some of the announcements that came on the news. Effective August 27th, 2025, the FDA has shifted the eligibility requirements for COVID vaccinations. Now, typically, once a year, you would get a COVID vaccination. Now, with the new eligibility requirements, if you're 65 years and up, you're covered. If you are an individual, whether you're a child or an adult, and you have one comorbid condition, that could be asthma, that could be some type of respiratory disease, it could be cancer of some sort, you're eligible as well for the COVID vaccination. Now it's more targeted and it's more risk-based. That's how the eligibility has adjusted. Some of the other health and agencies are still in the works of giving their recommendation with this adjustment that has been made by way of the FDA. So with that being said, if someone were to get a COVID vaccination and they were 65 years of age and they were healthy and they just wanted to do some type of preventative measure by way of vaccination, they would have to check with their insurance company now, or they'll end up paying out of pocket for something like this. So it goes into the bigger question of why are we vaccinating in the first place? We're not seeing as much outbreaks with measles, mumps, rubella. We're not seeing polio, diphtheria like that anymore. Yet our children are still it's being advised strongly that our children be vaccinated, and even in our adulthood, get the shingles vaccine, get the RSV vaccine if it's recommended. So why is there this push? So based off of these healthcare agencies, the education behind why getting these vaccinations is to prevent serious illness, to prevent death that could have been prevented by way of a vaccination, to protect vulnerable populations. So that's the elderly, that's pregnant women, that's infants and children that have weaker immune systems, for community protection. So thinking of herd immunity, if you vaccinate the masses, then there's less outbreaks of communicable diseases, some of which I've already mentioned. So it's thought to reduce healthcare costs because if less people are sick, less money needed for medications, medical treatments, and the like. It helps to stop those deadly diseases from spreading, and it prevents pandemics, epidemics, and the like. So imagine if we put this much emphasis on preventing by way of the choice that we make. Every week, you've been hearing from myself, the Kingdom Health team, about choosing life. Imagine if we chose life by being preventative with the choices that we make. Imagine if we chose to use that same energy to empower ourselves, individuals, and our families as well, to eat a nutrient-dense diet, to get the sleep that's needed, to plug out of social media and get the sleep that's needed. Give yourself the time to unwind and rest from the day, so that way we get the sleep that we need, the restorative sleep that we need, so that way our immune system can be at its optimal function. Imagine if we exercised and put that emphasis on exercising. Imagine if we put that emphasis on reducing or not even engaging in substance use. Imagine if we really reduced our stress and put that same emphasis, so we don't spread communicable diseases throughout our family line, right? We don't spread disease patterns throughout the family line. Imagine if we chose life so that we could live and our descendants would also live. This is not a broadcast to say vaccinate or not vaccinate. But if you're choosing not to vaccinate, we still need to make the choice to choose life today, right? We need to make the choice by boosting our immune system now. We know what the tendencies are, the patterns are, but it doesn't need to be the pattern for us or our children or our children's children. if we boost our immunity, not just for a moment, but for a lifetime, for a lifestyle, and through the generations, that we really do what we need to do to begin those healthy patterns one at a time, and we stay consistent with them. Imagine things could totally be different. These communicable diseases won't have to outbreak, and our immune systems will be a lot stronger. We see how the systems and society has been set up for us to be busy. Busyness is embraced, but imagine if we took the moment to pause and meal prep. Imagine if we took the moment to pause and take time for ourselves and exercise. Oh, what a different world this could be. But we as the people of God have the choice today between life and death, blessings and curses. I call on all of heaven to witness the decision that you and I make. Oh, that we would choose life so that we can live and our descendants can live as well. Hashtag, go ahead, put it in the chat, I choose life, and say how you're going to choose life. We're hearing the broadcast to vaccinate. We're hearing the broadcast. Some of us probably gotten texts from CVS and Walgreens and the pharmacies. Some of us have gotten notifications from our job. It's time to vaccinate. And that let's begin to vaccinate our lifestyle with the godly principles of wisdom that God has given us today. Choose life today. Like, share, and let's help others to be aware as well. Be blessed, everyone. I'll catch you here live next week or on the replay. Bye-bye.